Dr. Bala, hi, so nice to sit and chat with you. So you, in addition to being the regional dean here at the UT Health School of Public Health Dallas campus, I hear that you were also recently crowned kickball champion of Plano, Texas. Is that true?
Yes, last season we won the Plano Championship for kickball.
That's amazing.
It was the first season I played kickball. It was a lot of fun.
Did you score any runs? RBIs?
This season, first game.
You got one.
Yeah.
You're finally in the club. Okay. So would you, like, thinking about like having children, my career accomplishments, and then kickball champion of Plano, where would you rank that? do you
Kickball?
think? Yeah.
I think you had it in the right order.
The right order? Okay. I would have gone number one, but that's just me. Okay. Can you tell us a little bit about your research?
So my work is in improving primary care practice. That's the research program I've developed that has emerged from my background as a primary care doctor, and then also the PhD I went on and got in epidemiology, which allowed me to combine or integrate my medical background with my research background. And that, along with new areas of research that I have pursued in more recent times, such as implementation science, I'm using those methodologies to improve the practice of medicine, to improve primary care practice. We all know that our primary healthcare system is foundational to our healthcare system for all of our patients, yet it is definitely in dire needs. It's fragmented, care quality is often suboptimal. And so my research is really focused in improving primary care practice.
And so how did you decide that you wanted to do that kind of research?
Being a primary care physician, I could see firsthand all of the challenges in not only treating patients who come to you, but also for physicians to have a practice around them that can help them be the best doctors to their patients. And so when I discovered the field of public health and the methods of public health, it allowed me to combine my interests both in being a good doctor to my patients, but then also improving primary care for the populations of patients that I might come across, and then in later years working on research to improve medicine. So it's public health gave me the tools to be able to do what I was trained to do in medicine.
Speaking of implementation science, I think that you were just invited to be a plenary speaker at the 15th annual conference on the science of dissemination and implementation health. Sorry, that's a mouthful,
Yeah.
but a really big deal. Can you tell us a little bit about
Yeah,
that?
that's wonderful. I'm so excited to have been offered this opportunity to be the plenary speaker. You know, implementation science as a field is relatively new, but it's very intuitive to understand what it is. We do a lot of work in developing and testing new interventions, and then we find that it's effective, but they are often not completely adopted and implemented in the real world practice. You know, a great example is something like colorectal cancer screening. We've known for a long time that screening for colon cancer can save lives and reduce mortality rates due to colon cancer, but we still have a hard time getting it out in all of the clinics and health systems that we need it in, and at the optimal rates they should be at. So implementation science as a field has emerged to provide the tools and the methods and the measures to be able to increase adoption and implementation and sustainability of these interventions, so that we make the best use of all of the amazing evidence-based practices that we have.
Yeah, that's amazing. Yeah, so you probably won't brag on yourself, so I'm going to brag on you a little bit. So we have here that the planning committee selected you for your significant expertise and leadership in research on large-scale efforts to improve primary healthcare practice, as well as your clinical and implementation science expertise. So, wow, what a great compliment, right? And
Thank you.
And how do you think that how do you see your work contributing to improving primary care practice?
Some of the experience I gained from evaluating national large-scale projects that were trying to where grantees were trying to implement, appropriate blood pressure management for patients, which again, for those who have hypertension, is something we want more and more higher rates of adoption of those practices. And so those large-scale national projects really gave me a opportunity to learn about how to use implementation science methods to get evidence-based practices into clinics at scale.
I know that you are one of the founding co-directors of the UT Health Institute for Implementation Science. Can you tell us a little bit about what the purpose of that institute is?
The institute is really going to be focused on improving or increasing the capacity of our researchers at UT Health to be trained in implementation science, to nurture more researchers to do more implementation science, of course, do our bread and butter basic and applied implementation science research as we always do. We also want to engage our community partners in other larger at-scale implementation science activities. And that sort of is the vision for what this institute will do. One of the really unique aspects of the institute is that it is across the whole university, so it will engage all 6 schools of UT Health, the University of Texas Health Science Center at Houston. And our School of Public Health, as you know, has 6 campuses. So the institute has the potential to really have a statewide reach and impact in the activities that we do. And we hope that we will be able to engage all our campuses in doing that.
Wow, yeah, that's pretty unique, right? For not the first implementation science institute in the country, but perhaps the first to have the kind of reach that this one will have, right?
Exactly, and for a state as large as Texas, that is a significant infrastructure that we have to be able to do that.
And then finally, I just wonder, how do you see this Institute for Implementation Science developing over the next 3 to 5 years?
It's fairly new, not even a year old, and Dr. Maria Fernandez, who is my partner in crime leading this institute as the co-director, the second co-director. The two of us, we really hope to develop the infrastructure of the institute to support many other junior or even senior researchers understand the importance of bridging research and practice, and to develop larger programs of research as well as practice where our research innovations and evidence-based practices can translate or bridge from being on our bookshelves or in our labs to actually benefiting people on the ground, whether they are in clinics, whether they're in our communities. And really the intent of implementation science is bridging research and practice, and we want more and more of that to happen over the next several years.
So Dr. Bala, full professor of epidemiology at the UT Health School of Public Health, dean of the Dallas Regional Campus, or the Dallas campus, and co-director of the new Institute for Implementation Science. Thank you so much for speaking with me today.
Thank you very much. Appreciated it.
All right.